Right, while many countries have taken a hit because of COVID-19, India has had a mixed bag of experiences. Now, some have criticized the lockdown measure imposed on the country's population of some 1.3 billion just a few weeks ago, forcing migrant laborers to travel back home on foot. India has been reporting low numbers, though, which some say has to do with factors ranging from the climate to relatively little testing happening. But on Monday, a record high number of new cases were reported. Now, one Indian state looks like the mirror opposite of the rest of the country, and that is the southwestern state of Kerala, where the slogan "Break the Chain" has helped mobilize the population to flatten the curve. So joining us to discuss this important topic is historian and author Vijay Prashad. Vijay, thank you for being with us. So Kerala doesn't have nearly as many new cases per day compared to other Indian states. You wrote that it has much to do with its left-wing government and civil society organizations mobilizing the masses of volunteers to help make hand sanitizer and face coverings, cleaning public facilities, etc. Does it look like the Modi government may be willing to take a page from Kerala's example here?
Well, nice to be with you. The first thing to say is that Kerala is a state of 35 million people, 17 million women. Of the 17 million women, 4.5 million of them are members of a cooperative called Kudumbushri. It's an extraordinary state because people are organized into trade unions, women's organizations, cooperatives of all kinds. And when the first news came from Wuhan of the possibility of some kind of virus, the health minister, K.K. Shalja, immediately went into action. You know, she is a science-based person, not a fantasy-based politician, and her science-based, evidence-based thinking led her to call upon public groups to act, very swiftly. The state went into action, public groups went into action, they built sinks at bus stations, they created hand sanitizer, they made masks, a variety of things. The combination of swift state action and an amazing public kind of awareness really helped keep the number of infections low, the number of people who died very low.
And Vijay, on the day that Narendra Modi announced a partial curfew, the Kerala government announced a $270 million relief package that included free food, loans to families through the state's women's cooperative that you just mentioned, 2 months of pension payments, and even suspending loan and utility payments among some of the other incentives happening in Kerala. So what kind of lessons do you think the United States and perhaps even other countries can take away from the state of Kerala?
Frankly, I don't want to beat around the bush here. The government of Kerala is a communist government, and their principal priority was the well-being of the people. So whereas the government of India, very callously, with no notice, essentially told millions of migrant workers, walk home. You are daily breadwinners. We don't really have any policy for you. We're not going to do anything on your behalf. That was the attitude of the Indian government. The government of Kerala, left-wing government, had a completely different attitude. The principal issue was, how do we care for people? And because of that, it did very simple things, things that should have been done by any decent, sensitive government. For instance, in every single local self-governing municipality, it created community kitchens so that people who are going to have a hard time buying food could just come there and pick up food, or the youth movement in the state would deliver food to people's homes. I mean, there's a sensitivity in these left-wing governments that I really want to underline.
Yeah, it sounds like they really care about each other as neighbors there, the way people should be, the humanitarian angle of this. And lastly, Vijay, how would you compare Kerala's experience to this pandemic versus the rest of the country, where Modi's government has issued, very harsh lockdowns and has done, what people would criticize as very limited measures in curbing the outbreak?
You see, it's important for people to understand that in India, unlike China, 1.5 billion people, almost half the population is a day away from starvation. This is very different from China, where nutritional intake is much higher. So in India, a government that does a lockdown must really create policies to alleviate famine and hunger. The Modi government has done nothing. And I'm very, very worried that we're going to have famine-like situations in India. We'll have food riots. The situation is only going to get worse because this government, the Modi government, is callous towards very simple things like the need of people to be able to eat a meal or 2 meals, or 3 meals per day. We look at Kerala and see that the government's first policy after contact tracing and so on was food.
All right, unfortunately, we have to leave it right there. Vijay Prashad, thank you so much for sharing the insight on Kerala today.
Thanks a lot.
Also the fact that there is no cure or vaccine at the moment, and how prepared is India? Because we've seen in Kerala, for example, 3 cases reported and thankfully they were discharged. We've seen Kerala fight virus cases like Nipah, Zika. They have been quite efficient. What can be learned from these models?
I'm glad you asked that question, Devina, because Kerala is one state that has developed its health infrastructure really well. And it's not just hospitals, but it's the primary healthcare centers, which is the first level of contact of the population. So at one end, they have done that. Mm-hmm. At the other end, they have developed very good capability of diagnosing, very good capability of tracking these viruses and infections.
Kerala has its picturesque backwaters and pristine beaches. But now there are no tourists in these houseboats. Instead, they're being converted into isolation wards for coronavirus patients.
We have had extensive discussions with the houseboat owners associations. All the registered houseboat owners have agreed with the proposal and are willing to support the district administration in this respect.
Some of India's first confirmed cases of the virus were here in Kerala, as some of the millions who work overseas returned home. At one point, Kerala had the most cases in India. Now that's changed, which the state's leaders put down to intense efforts to break the chain of transmission.
The strategy was test again, and every positive case trace all the contacts for the last fortnight, test them, quarantine them positive, trace again, till the chain is broken.
That tracing is happening in call centres like this, using technology such as geotagging to monitor clusters of cases.
We had to follow up 10,000 people, nearly 10,000 people every day to know whether they are developing any symptoms or not.
The communist-run state says it's also been stopping the spread of the disease by ensuring workers who've lost their jobs still have a roof over their heads.
Nobody can be ousted from the quarters they have been staying in Kerala. And if we find any camp not sufficiently hygienic and cramped conditions, local governments are asked to set up new camps and also ensure there's medicine and food for every one of them.
Restrictive measures have seen 1.3 billion Indians in lockdown. Back in Kerala, the annual monsoon rains are due in a few weeks, and the fevers that often come with them could make fighting the coronavirus more complicated. Alexia O'Brien, Al Jazeera.
There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Water.
How do I protect myself from corona?
Avoid close contact with other people. Avoid touching your eyes, mouth and nose. Wash your hands, often with soap and water for at least 20 seconds.
And from yesterday onwards, the second robot is actually cleaning all door handles.
Okay, let's leave you with our 3 images of the day. As always, we bring you our top 3. Following South Korea's lead, now Kerala has installed 6 walk-in kiosks for mass collection of samples for coronavirus testing. The kiosks have been named Whisk Walk-in Simple Kiosks. Kerala once again is showing the way to the rest of the country. I keep saying what Kerala thinks today, India is thinking tomorrow. More testing is the Kerala way forward.
Press the bell icon on YouTube and don't miss another update.
Namaskar. Welcome to another episode of Editorial. Today I have a very informative and interesting episode for you. You see, while our country is fighting against the deadly coronavirus, there is one state in our country that has managed to flatten the coronavirus curve. And this state is now almost becoming an example to not only to our country but to the world. And that state is Kerala. Let's discuss Kerala today. Now, before we discuss the Kerala story, let us understand the Kerala scenario. You see, in the last 5 years, Kerala has faced two major floods. Kerala faced Nipah virus in 2018, which was as dangerous as corona, if not more. Now, the first thing is, Nipah virus was successfully handled by the current health minister, Mrs. K.K. Shailaja. She is called Shailaja teacher. She was a school teacher before she became a minister. So she successfully handled Nipah virus, number one. Number two, because of Nipah virus, the state government gave tremendous impetus to healthcare, and the state government invested close to 4,000 crores on healthcare in Kerala. So, to a certain extent, Kerala was experienced to handle a virus epidemic, and they also had a fairly decent healthcare infrastructure. Now, the Kerala model can be explained in three perspectives. One has to look at it from three perspectives: the medical perspective, the administrative perspective, and the social perspective. Now let's start the story. 13th of January, 3 students landed in Kerala from Wuhan province of China who tested COVID-19 positive. So from that particular day, from the 13th of January itself, the passengers were screened before they entered the Kerala soil. Hospitals where people with symptoms were transferred, and people who were tested positive was transferred to the National Institute of Virology. These systems were put into place immediately and fast. So doctors were mobilized, medical kits were mobilized, the infrastructure was set in place. So medically, they equipped themselves very, very fast. Like I said, way back from January 13th. Now let's get into the administrative angle. From the administrative point of view, the biggest step that the CM Pinarayi Vijayan took in Kerala was setting up this 24-member quick response team. This 24-member quick response team was headed by Shailaja teacher. And what this team really did is this team coordinated with all the departments in the state. It coordinated with the municipalities, it coordinated with the Jilla Parishad, it coordinated with the police, it coordinated with the emergency services, it coordinated with the hospitals. So this one team was handling the entire show, and because of that, there was easy flow of information and infrastructure. So that's a big decision they took. The second thing that they realized was there was a huge amount of rumors that were spreading, and people were worried. What Kerala did, Kerala immediately started a helpline where people who had misinformation, people who were scared for their loved ones or for themselves could call up and they would be counseled. This worked magic. This worked magic in Kerala because the helpline, I am told, was absolutely flooded with calls, and most of the people were answered and answered well. So that was the second thing they did, and the second thing they did beautifully. The third thing that the CM did way back, I'm talking about way back in January, is he had a meeting with the sanitizer manufacturing company, he had a meeting with the mask manufacturing company, and he increased the production of sanitizers and masks. Now, he realized that sanitizing was one of the most important things. Sanitizing your hand was one of the most important things to prevent coronavirus. So he actually installed electronic sanitizing dispensers across the state. So people could have easy access to sanitizers and could use it whenever needed. So that was the third step. That was the third very important step that he did. The fourth step that he took from an administrative perspective is he started the community kitchens. Now, community kitchen ensured that the migrant workers and even daily wages worker, but most importantly migrant workers, could get 2 square meals. Even Kerala faced their share of problems due to poor migrant workers who wanted to go to their respective homes. But all the same, it was contained to a large extent. Now, from a social perspective, the first thing that Kerala government did is they announced 20,000 crores of relief for the people of Kerala. The second thing they did was they ensured that people were given rice, people were given spices, and people were given oil, so that at least they don't face problem of food, especially the poor class. The third thing what they did is very, very thoughtful of them is, you see, while the school and colleges were closed, a lot of kids depended on the midday meals that the school provided to them. They ensured that these kids were given midday meals at their residence. They packed their midday meals and sent it to their residence. That was seen very positively. And last but not the least, you see, this government ensured that the retired state government employees, their pension date was preponed, so that the senior citizens had cash in their hand. Mind you, senior citizens were the most vulnerable age group for corona fatality. So this group had cash in their hand. So broadly, they took care of all the three aspects. They took care of the medical aspects by ensuring the infrastructure was in place, by ensuring everything happened way back, way early than what the rest of the country did. The second thing they did was administratively, they ensured that the coordination was done perfectly. They ensured that the masks and sanitizers, which was the most important thing for prevention and management of coronavirus, was provided to both the common men and the healthcare workers. And thirdly, and the community kitchen, which helped the migrant workers. And thirdly, socially, they ensured that there was food available to people, and especially for senior citizens, they ensured cash was with them. So this was broadly what the Kerala model is, and this was executed beautifully. Now let me tell you what happened because of that. Because of this kind of handling, today, if you look at some figures, the recovery rate of Kerala is 50% versus 11% of the national recovery rate. The mortality in Kerala is 0.75% versus 3.34% nationally. And if you want to add another statistics, 6.85% of global fatality percentage. The transmission percentage in Kerala is just 0.4 versus 2.6 nationally. This is what the figures are. Let me give you today's figure. As on today, 18th April at 10 a.m., Kerala has a total of 396 COVID positives. Just one number was added between yesterday and today. 255 of them have recovered and they are on their way home. They have only recorded 3 deaths. Like I said, fatality percentage is 0.75. Now, if you look at Indian average, as on today, India has 14,378 positive patients. 992 were recorded between yesterday and today. 1,992 recovered and are on their way home, and 480 of them are dead. So the fatality percentage of India is 3.34%. Now, my 2 bits. It is always advisable to use a successful model and replicate that to the rest of the country. It is always effective and it is always wise. I know the center and the state of Kerala are two different political parties, but if a task team would be set up, if a task team could be set up with somebody like a Shailaja teacher heading it from a national perspective, and the best of officers, bureaucrats as part of that task team, including the DM, the district magistrate of Bhilwara, who did a fantastic job there in Rajasthan. If such people could be incorporated in this national task team, possibly this team could handle the fight effectively. The second point that I want to make here is this entire thing about quick response team that Kerala did to coordinate between departments. I think, at least whatever I am seeing on ground, the biggest problem here is the health ministry coordinating with the municipal corporation doing their own number, the health ministry doing their own number. The panchayat doesn't have a clue what the health ministry is doing, neither they have a clue what the BMC is doing. While each of these people are working very hard, there is no doubt about it, but we see a clear lack of coordination. This 24-member team that Kerala set up as a quick response team and coordinating between them did a fantastic job, and possibly the efficiency of Kerala increased because of that. What we recommend is every state replicate this quick response team and institute this quick response team. This is another point that I wanted to say. The last point that I want to make, and which I make every day, is not so much so the coronavirus as much as we are scared of what is going to happen after the coronavirus. What is life after coronavirus? How will the economy grow? Where will we get jobs from? What will happen to MSMEs? It is imperative that the central government puts up a team together. Team of few of the best economists in the world. Most of them are Indians. Raghuram Rajan, Amartya Sen, Jayati Ghosh. Such people brought together, and we create a think tank that will help us tide over the economic problems that we are going to face, and we are definitely going to face. I think this is one time for Shri Narendra Modi, our good Prime Minister, to ensure that he goes above party line. He becomes a true statesman that his party claims he is. I hope he considers my humble request. Namaskar.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
Sister, thanks for everything.